In this lesson, we'll break down the two main parts of the HHA certification exam, the written test and the skills evaluation. Knowing what to expect on each section will help you prepare with confidence. Whether you're reviewing multiple choice questions or practicing real-world care skills, this overview will guide you through the exam structure and help you understand how each part is scored. The Home Health Aide HHA exam is divided into two primary parts. Written or oral exam. Test your knowledge of theory and caregiving practices. Skills evaluation. Assesses your ability to safely and correctly perform hands-on caregiving tasks. Most candidates must pass both parts to earn their HHA certification. Let's take a closer look at the structure and format of the written or oral exam breakdown. Structure and format. Usually consists of 50 to 100 multiple-choice questions. Some states or agencies may offer an oral version for candidates who have reading challenges or prefer to hear questions, typically completed on paper or a computer, depending on the testing center. Topics covered. The written portion assesses your theoretical knowledge of caregiving duties. Topics usually include personal care, bathing, toileting, grooming, dressing, basic infection control and universal precautions, nutrition and food preparation, body mechanics and safe transfers, communication skills and reporting changes, basic anatomy and physiology, mental health and emotional support, patient rights and confidentiality, emergency procedures, for example, what to do if a client falls or has difficulty breathing. Here are a few examples of the types of questions you might see on the written portion of the HHA exam. Which of the following is the best way to prevent the spread of infection? This question tests your understanding of proper hygiene and infection control procedures. What should a home health aide do if the client refuses to eat? This assesses how you respond to common caregiving challenges while respecting client rights. When assisting a client to walk with a cane, which side should the aide stand on? This focuses on safe mobility practices and correct support techniques. When it comes to scoring, you typically need a minimum passing score of 70 to 80% depending on your state or training program. Results may be available immediately or within a few days after the test. If you fail, you may be allowed to retake only the failed section, depending on your state rules. Let's walk through what to expect during the skills evaluation portion. Purpose and format. The skills portion tests your ability to perform caregiving tasks in a safe and professional way. You'll demonstrate your skills on a live volunteer, a person or mannequin, in front of a test evaluator. You'll usually be asked to perform 3 to 5 randomly selected skills from a standard list. Common skills tested. Here are some of the most frequently tested skills on the HHA exam. Hand washing, always tested first. Measuring vital signs, temperature, pulse, respiration. Transferring a client from bed to wheelchair. Providing perineal care. Assisting with ambulation using a gait belt, making an occupied bed, providing mouth care or denture care, feeding a client, recording intake and output, helping with a bedpan. You are graded on both accuracy and safety, including proper technique, respect for patient dignity, use of gloves and hand hygiene, communication during care, following procedure steps in order. Now let's talk about how your skills evaluation is scoring. Most states use a pass/fail grading system for each skill. You may fail the entire section if you skip a critical step, e.g. hand washing or safety precautions. A second attempt is usually allowed if you don't pass on the first try. Let's go over what you can expect on the day of your HHA exam. Arrival and setup. Arrive at the test center early with your ID and required documents. Wear scrub-like or professional clothing. Some states require this for skills testing. Bring any materials the program instructs you to bring. Follow instructions carefully. Talk only to test staff. It's completely normal to feel nervous before the skills test. Many candidates do. But don't forget, you're not being judged on perfection. You're being evaluated on whether you can provide safe and respectful caregiving. And here's the key: practice helps. Review each skill multiple times before your exam to build confidence and reduce stress. With preparation and a calm mindset, you'll be ready to succeed. Here's a quick recap of what we've covered about the HHA exam. HHA exam includes a written/oral test and a skills evaluation. Written test: 50 to 100 multiple-choice questions on basic home care topics. Skills test: perform tasks like vital signs, feeding, and mobility assistance. Hand washing is always tested and must be done correctly. Must pass both parts to earn certification. Candidates are scored on accuracy, safety, and proper steps. Preparation boosts confidence on test day.